Senator from Colorado is recognized.
Mr. President, good morning. I too, before I speak on health care, want to join my colleagues in congratulating Senator Byrd. I too am in awe of his accomplishments, and I too admire his affection for the United States Senate and will endeavor in my service here to model his example. Mr. President, I join my colleagues this morning to discuss an issue of great importance to Colorado and to me. These past few weeks, as the presiding officer has, and many of us on this side of the aisle, I've spoken about comprehensive health insurance reform as a key to strengthening and securing the lives of middle-class Americans. One of the most important components of that goal is ensuring that we do everything to help small business owners and their employees get affordable health coverage. As the senator from Virginia mentioned, over the last 15 years, small businesses have created over 65% of the new jobs in our country. Yet the power of this job creation machine is being threatened by the exploding cost of health care. And Mr. President, it'll only get worse if we don't act. If we do not pass health insurance reform, small businesses owners will continue to see the cost of providing benefits eat away at their bottom line. In my home state of Colorado, premium costs for small businesses are projected to more than double over the next decade. These unsustainable cost increases not only harm current businesses, but they prevent the growth of new ones. Mr. President, more and more would-be entrepreneurs across the country are deciding not to start their own companies due to the fear that they won't have access to affordable insurance for their families or for their employees. Mr. President, unfortunately, this fear is too often justified. In the insurance market today, small businesses lack the bargaining power to get affordable rates that many large employers enjoy. And they find themselves subject to unpredictable and massive spikes in premiums. And that's why it's so important that we pass a health care reform bill that takes proactive steps to address the rising cost of health care. And I have to tell you that I've been encouraged by the proposals that I've seen thus far. For example, a recent analysis by the nonpartisan CBO, the Congressional Budget Office, of the Senate Finance Committee bill estimates that the reforms therein would save small businesses $65 billion every year for the next decade. The proposal would do this in part by taking steps to transform our health care delivery system to one that produces higher quality care at lower costs. It would also include tax credits that were specifically designed to help cash-strapped small businesses provide coverage to their employees. And additionally, new reinsurance programs would reimburse employers struggling with the particularly high costs of catastrophic insurance. In addition to these pro-business proposals, we also need to make sure that the market offers new and affordable options for those employers who want to offer coverage but currently cannot afford to do so. The new health insurance exchanges envisioned under the reform packages before us would permit small employers to purchase policies that spread risk across a much larger population. New consumer protections would also keep costs down by prohibiting insurers from charging higher premiums on the basis of health status or gender. Mr. President, right now, being a woman is a pre-existing condition under the terms of many insurance policies. That's just not acceptable. Employers would also be able to keep expenses down by promoting personal responsibility, offering wellness premium discounts to employees who make healthy choices. Enacting meaningful health reform is necessary for ensuring productive small businesses, new American jobs, and a strong economy. Independent and unbiased analyses estimate that in the next 10 years, reform can save upwards of 80,000 small business jobs and raise wages by more than $30 billion annually. Those are more than promising numbers, Mr. President. As the Senate begins its historic floor debate on health insurance and reform, you can expect that I and my colleagues will continue reminding the other side of the aisle just how critical reform is to the small business community. No amount of misleading rhetoric or misdirection by the defenders of the status quo will be enough to convince the American people that we should continue forward on our current unsustainable path. Mr. President, I say to my colleagues, let's work together over the coming weeks to strengthen this legislation, empower small businesses, and put America's healthcare system on the road to recovery. Thank you, Mr. President. As I yield the floor, I want to acknowledge the great leadership of the chairman of the Small Business Committee, the Senator from Louisiana. Thank you.